Our topic is focusing on Olmesartan. Olmesartan is an enzyme used by Biochem Inc. to produce Vanacar. Biochem Inc. is an American multinational biotechnology company based in Cambridge, Massachusetts. They are specializing in the discovery, development, and the delivery of therapies for treatment of neurodegenerative, hematologic, and autoimmune disease to patients worldwide. Their mission is clear: to be the pioneers in neuroscience. They believe that no other disease area holds as much needs or as much promise for medical breakthroughs as neuroscience. Olmesartan is an angiotensin II receptor blocker. The mechanism of action of olmesartan is as an angiotensin II receptor antagonist. Olmesartan selectively binds to the angiotensin type 1 receptor subtype in vascular smooth muscle and adrenal gland, thereby competing with angiotensin II for binding to the angiotensin 1 receptor. This prevents angiotensin II-induced vasoconstriction and interferes with angiotensin II-mediated aldosterone secretion, thereby decreasing aldosterone production and preventing aldosterone-stimulated sodium retention and potassium excretion. Olmesartan is used to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. Olmesartan is available as the brand name drug Vanacar. It's also available as a generic drug. Generic drugs usually cost less than the brand name version. In some cases, they may not be available in every strength or form as the brand name drug. The main purpose in hypertension treatment is the reduction of cardiovascular disease burden. Among different first-line antihypertensive drug classes, angiotensin receptor blockers are characterized by their both good effectiveness and tolerability. Furthermore, the interruption of the renin-angiotensin cascade is related with several benefits in target organ protection and cardiovascular prevention. Among different angiotensin receptor blockers, olmesartan has been examined in several trials of organ protection, showing improvements in several disease markers, such as microinflammation, regression of both plaque volume and vascular hypertrophy, as well as microalbuminuria prevention. Olmesartan has also been widely examined in combination of either hydrochlorothiazide or amlodipine, as well as with both drugs, in a single pill triple combination, showing improvements in antihypertensive efficacy without significant effects on tolerability. This treatment strategy based on a drug with such characteristics and the availability of different types of combinations with other first-line drug class may prevent an effective way for achieving blood pressure control in a majority of hypertensive patients, and this could also be related with a better cardiovascular disease prevention. Angiotensin II receptor antagonists can cause symptomatic hypotension in patients with an activated renin-angiotensin system, such as volume and sodium depleted patients. Therapy with AR antagonists should be administered cautiously in such patients and in those predisposed to hypovolemic or hyponatremic states. Volume and sodium depletion should be corrected prior to initiating therapy with AR antagonists, and the patient should be hemodynamically stable. Indeed, patients at risk for excessive hypotension should initiate AR antagonist therapy under close medical supervision, preferably with a lower dose, and follow closely for the first 2 weeks of treatment and whenever the dosage of AR antagonist or diuretic is increased. Here are some common olmesartan side effects and their following treatments. The first one is feeling dizzy and lightheaded when standing up, and the solution is to get up and move slowly. If beginning to feel dizzy, sit for a few minutes before you stand up again. The second one is tummy pain and indigestion, and the solution is to stick to simple foods and avoid rich or spicy meals. The third one is diarrhea, and the solution is drink plenty of water to replace lost fluids. And the fourth one is cough and flu-like symptoms, aches, pains, urine infections, and feeling tired. And the solution is to consult a doctor if any of these get troublesome. And the last one is change to the result of some blood tests. And the solution is to have blood tests from time to time to check your body. Here are the references we used for our research. Thanks for watching.